morning. My name's Ted O'Connell. I'm the program director here at the Kaiser Permanente Napa Solano Family Medicine Residency Program. It is our pleasure to welcome all of you. Thank you for making the time in your busy interview seasons to join us. We're going to give you just an overview of the residency program. The slide deck's just about 12 slides long. The idea is really to give you a broad view of the residency, kind of talk about our philosophies, kind of some of our core strengths. Certainly, we're happy to take questions. You'll get a lot of details filled in during the course of your interviews and your tour. We have a very thorough website that will also help fill in the details. All of that being said, if there are any questions at the end of this presentation, I'm happy to take those for you. In terms of your interview day today, we'll be here until about 9 o'clock or so. We'll leave a little bit of time at the tail end of my presentation to answer questions and also give you a chance to use the restroom and get some food before you go off on your interviews. Each of you will have a series of 3 interviews. Then Ethan will take you off on a tour. We'll take you around the medical center here and also over to La Clinica de la Raza. It's a local FQHC with whom we work. And then about 12:30, we'll have you back here for lunch with some of the residents and some of the faculty. I will step away at that point, partially so I can prep for my precepting this afternoon, and also just so that you really get a chance to meet with the residents and faculty. You'll have already probably had enough face time with me. In terms of our residency program, kind of our core philosophy and the reason why we do things the way we do and why we design this residency the way we did is our primary goal here is to train our residents to be able to go out and practice family medicine in just about any environment. And that's really what drives the decision making and the curriculum and the way that we do things. So structurally, what are we? I like to think of this as a community hospital that's part of a much larger health maintenance organization in Kaiser Permanente. We have a very academic environment, so you have a lot of those strengths that you might find at a university program, and we'll talk about some of that. And then we have a real commitment to community medicine that's built in throughout the curriculum. So then the question becomes, how exactly do you build out this full spectrum family medicine training? In my mind, and what we've done is strong inpatient training, strong outpatient training, and plenty of procedural training throughout the curriculum. We have core pillars of the residency of academic excellence, and then a real commitment to social justice, community medicine, and global health, and we'll talk about how those are built into the residency throughout. We have community medicine and global health rotations that are kind of part of the core curriculum. We'll dive into those details in a little bit. A practice management curriculum that runs throughout the 3 years, so we teach you how to practice in different environments. And then plenty of elective time. We know that family medicine is a broad field. It means different things to different people. You will all probably want to flex your careers slightly differently, and we want you to be able to prep yourself to be ready to go wherever it is that you're going to go. So whether you're filling out academic areas that you want to get stronger in or a particular type of practice, we really want you to use your elective time to prep yourself for your future careers. And so we've maximized the amount of elective time that you can actually build into a family medicine curriculum. I want to spend some time talking about the community of Vallejo because this is very central to what we're doing here. All of you, I think, realize that Vallejo is very centrally located here in the Bay Area. This is an incredibly diverse community. It's actually been named the most diverse city in America by Forbes magazine. We run between 20 and 25% of the major racial groups that you can check off on a census form. So Asian Pacific Islander, African American, Latino, and Caucasian all represent roughly quarters of our patient population here. Vallejo is quite an economically underserved community. Back in 2008, at the time, Vallejo was the largest city in America to declare for bankruptcy, and there were a lot of economic issues leading into that, and then kind of as a result of the bankruptcy where they still haven't completely recovered. The unemployment rate here is pretty significant. There are a lot of disease burdens that kind of go along with being socioeconomically underserved, high obesity rates, high rates of diabetes, heart disease, a lot of adverse childhood experiences that we are trying to address, and we'll talk about that in a little bit of detail. The high school graduation rates here in Vallejo trail the national average, and the school district is still significantly in debt to the federal government as a result of the bankruptcy. So that creates kind of a drag on the system. And we'll talk about what we're trying to do in the school districts to improve kind of the quality of education and experience there. But very much a community in need that is also surrounded by some more well-heeled communities. And so you get this real diversity of patient population coming into this medical center. And the way I like to think about it, it's a really nice environment because you never know who's going to walk through your door, and yet you're able to roll out the same red carpet treatment for every single person who comes to see us. We have a very significant Medi-Cal patient population here, a very significant Medicare patient population here. So really a really diverse patient experience, and I think you'll see that as you walk around during your tour today. I get asked every year, what's the greatest strength of this residency program, and I consistently say it's the people. We have a really outstanding group of residents who are dedicated, bright, hardworking, really committed to both their own academic work and the work that we're doing in the community. We have a very diverse group of faculty. When we were designing this residency program and hiring, we very intentionally hired faculty members who had graduated from a wide variety of different residency programs so that as we built our own curriculum, we would have that diversity of thought here in terms of what made for the best experiences in each of these other residency programs, and tried to build as many of those into this residency program as we could. The faculty has very broad spectrum practices, and we'll talk about that in a little bit more detail. And then a very collegial medical center. This attending staff across the board is really committed to our residents and their education and their well-being. And I want you to ask the residents about that, but it's really a great place to work and to be educated, I think. So I want to talk a little bit more detail about what full spectrum family medicine means and how we do that and how we ensure that the residents really get this full spectrum experience while they're here. So first and foremost, the residency clinic here is a level 3 NCQA certified patient-centered medical home. So we've gone through that process and have the residents embedded in that experience and also teach to that about what it means to be part of a PCMH. We make sure that each of our residents, when they start with us, has what we consider to be an ideal patient panel. And so we actually spend a lot of time designing each resident's panels so that they're roughly 50-50 male-female. We match resident language abilities with patient language preferences. We make sure each resident has plenty of pediatrics because we really want to make sure you come out of training here very comfortable with pediatrics, which doesn't always happen in every family medicine residency program. So our residents are given 30 to 40% pediatrics in their panels, which is a really high number. A lot of programs struggle to get to even 10 or 20%. So we're running roughly double that. We make sure they have plenty of geriatrics in their panels, and then the remainder of the panel is kind of that middle age group. So you get families that stay together and prenatal care and all the other things that go along with family medicine. We teach the full spectrum of procedural care. So if there are any that I don't address, I'm going off the top of my head, but if I miss any, let me know. But on the skin side, shave biopsies, punch biopsies, excisional biopsies, abscess management, suturing, foreign body removals, lumps and bumps, lipomas. On the women's health side, PAPs, IUDs, endometrial biopsies, Nexplanon, cervical polyp removal. Termination training is an opt-out. On the OB side, labor management, ultrasounds, IUPCs, fetal scalp electrodes, vaginal deliveries, perineal laceration repair, vacuum deliveries when it's appropriate, and assisting on C-sections. On the inpatient side, running codes, paracentesis, thoracentesis, lumbar puncture. What I will say is on the inpatient side, it's a little bit more difficult. You can't run a paracentesis clinic like you can with an outpatient procedure clinic. So it's a little bit more related to what your patients actually need, and oftentimes it's helpful if you work to get procedures if that's something that you want to get, but we very definitely have the patients who need the procedures. And then we have an ultrasound curriculum that I'm going to talk about again in a little bit more detail. We have a behavioral medicine curriculum that runs longitudinally throughout the 3 years that's staffed by a psychiatrist and a psychologist, so you have that kind of diversity of experience in terms of learning behavioral medicine. We have a geriatric curriculum that runs across the 3 years, staffed by one of our faculty who's a geriatrician, so you get that expertise in terms of your geriatric training. And then we have faculty, family medicine faculty, who are very well represented across the medical center. So up on labor and delivery, we have 9 family physicians who work up there. So when you're up managing labor and delivering babies, you're being taught by family medicine, OB, and nurse midwives. We think that's really important because there are 3 different training traditions, 3 different ways of managing labor and doing deliveries, and we want you to have that breadth of experience so that if you decide to do OB in your career, you have that many more tools in your tool belt. We also have 6 of our family medicine faculty who work on the inpatient medicine service. So when you're on the inpatient service, half of your time is with family medicine faculty, half of your time is with hospitalists, attendings. When we have family physicians who work in the emergency department and the rapid care and in the newborn nursery. So we as a specialty are very well represented across the medical center. I want to spend some time talking about community medicine. As I've already said, this is really central to what we're doing here in this residency program. And it's not something that we just dabble in or tell you can do in your off hours or your elective time. It's really built into the core of what we're doing. And I want to talk about how we do that. So longitudinally across the 3 years of training, each resident goes to La Clínica de la Raza on a regular basis in place of one of their family medicine clinics here. So that's a longitudinal experience across the residency training. And really the goal of that, part of it is our community partnership with La Clínica. We think it's the right thing to do. What it also does is it gets you into a different training environment. We here at KP are in the fortunate position of being in a very well-resourced environment where you can get everything that you need for your patients. But that's not reality wherever you go, and we want you to get experience being in different training environments. And so by being at La Clínica, besides our community medicine mission, it really helps teach you how to practice in a less well-resourced environment. We also have focused rotations in community medicine. So there's a 2-week block in the intern year when you have a community medicine rotation. In the second year, you have a procedure clinic that takes place at La Clínica de la Raza. And then in the third year, another 2-week rotation in community medicine. During that time, if you would like, you can actually use that time to do a global health rotation. You certainly can do that during elective time, but we just wanted to carve out additional opportunities for global health. And with the understanding that local is global and global is local, we thought it made sense that community medicine could be flexed into global health. And then the third way that we build community medicine into the curriculum is through our relationship with the Vallejo Unified School District. We have now had a many years relationship with them. Each resident who comes into our training program is assigned to one of the middle schools or high schools in the Vallejo School District. And the idea is that over the course of 3 years, you get into the schools, start to meet their leadership, and then you develop, implement, and by the end of residency, report out on a project that you've done at the schools. This is done with plenty of guidance and plenty of support, so we're not just throwing you out there and saying, do something great. The idea is, though, to really try to help the schools along, whether it's from a health education standpoint or a stress-related standpoint or whatever really we can do to try to help improve the student experience, the teacher experience, and hopefully improve not just graduation rates, but students thinking beyond the end of high school into higher education and careers. The way our residents have elected to do it is to actually work as a group in terms of their projects. So each resident in a class has their own school, but then the group of 6 residents works together to develop a project. It kind of helps keep things moving along when they're on busier rotations. I think there's a lot of value in working with groups. Our first group of residents worked on a stress reduction project. They partnered with Youth Alive, identified students that were at particular high risk of stress, and then worked to get them identified and plugged into some of the programs that Youth Alive has to try to support them. Second group of residents did a project to look at teacher stress and teacher burnout and partnered with our postdoctoral psychology students here to develop some stress mitigation strategies. The third group worked on a suicide prevention program. So there's some really interesting stuff that they're doing out there in the community. We have a number of other organizations with whom we work. There are migrant farm worker events that take place periodically. We get the residents out to experience that. KP SOARS is a very interesting program that helps. It's part of our partnership with La Clínica de la Raza. For those of you who've ever worked in a community clinic or a free clinic, you know how difficult it can be to access specialty care for your patients, and sometimes studies like CT and MRI. Because of our nonprofit status as an organization, we're actually able to provide that for patients at La Clínica that otherwise don't have access to it. And so the providers at La Clínica, including our own residents, are able to refer patients into the KP SOARS program. It's actually administered by our residency program, led by our community medicine global health fellow. And so what happens is we review those referrals on a monthly basis, attach a resident to each one of them, make sure the patient is plugged into the appropriate department, follow them up to make sure they don't get lost in the shuffle, and then follow them throughout the duration of their care, and then provide a handoff back to La Clínica to make sure that the communication has been complete. So I think a really excellent program there. And then a number of other things, the Jesse Bethel High School Clinic, Olay Health, those all get built into community medicine rotations and also take place intermittently, and so there's some additional opportunities for the residents to get involved there. We are very significantly involved in advocacy. That is part of our didactic curriculum that we provide. There's actually now a 2-week residential resident elective and health policy that is hosted. It was actually developed by Tessa Stecker, who is our fellowship director and one of our faculty. It's taking place right now, and we have a couple of residents going through that. We're involved with the CAFP. A couple of our faculty, we essentially run the Solano County chapter of the CAFP, so we're involved there. And then every year we get involved with Lobby Day up in Sacramento and take a group of faculty and residents up there to advocate for the issues of the day. Global health is also built into our core curriculum. We are in the very fortunate position of having a regional graduate medical education global health program for Kaiser Permanente in Northern California. They will provide financial support for residents to go do global health trips, which is a very unique thing in residency, so you're not put in a situation where you're trying to find your own financing for global health trips. They, as part of their program, have 8 sites that they have vetted, and the idea is they've been vetted for safety and for clinical and educational experience, but probably more importantly, they're under this umbrella with the idea that we want to have a longitudinal ongoing relationship with some sites so that we're not doing medical tourism, but actually being really involved. So there are currently 8 sites across the globe: Honduras, Ecuador, Guatemala, Kenya, Zambia, Vietnam, Cambodia, and India. You certainly can do rotations at other sites if you would like, but those are the ones that are under our umbrella. The site in Honduras is our residency's own contribution to that global health program. We helped establish that relationship with the site in Honduras a couple of years ago. We're now going on trips there a minimum of twice a year. In July of each year, one of the unique things that we do is we actually carve out a period of time where the entire third-year class can go as a cohort together. We think that's a unique opportunity for a whole class to be able to go on a global health trip. It is by no means required. We'll never require anybody to do global health, but it's a pretty unique experience and a real commitment on our part to take an entire senior class out to be able to go on a global health trip. We do have a community medicine global health fellowship here that we established. To our knowledge, it's the only fellowship in the country that combines both community medicine and global health. That is now being rolled out into other Kaiser residency programs across the region. We will be the only community medicine global health program. Some of the other ones have, the one in San Francisco will have a focus on homeless care. The site in the internal medicine program in Oakland will have a focus on health equity. But the idea is to have more of these community medicine fellowships because they really help maintain and expand our residency's involvement in both community medicine and global health. Scholarly activities are quite robust here. I talked about that this is a real academic center. Every Thursday afternoon is dedicated to an academic half day for the residents. So during that time, we have didactics, workshops, time for the residents to work on their community medicine projects so they're not doing that in their off hours, time for advocacy work. So there's a real commitment there. Friday mornings are inpatient medicine morning report. We have monthly journal club, we have board review, we have a monthly M&M conference, which is very different than what you experienced on your inpatient surgery rotation. Ours is very benign and really intended to focus on trying to improve patient care. Those M&M conferences actually lead to resident involvement in QI projects here in the department and in the medical center, and sometimes even more broadly. We have some residents working on an AAFP immunization program as part of their QI work. Every resident finishes with at least one piece of scholarly activity during the course of their 3 years. The work that you do in the Vallejo school district culminating in a presentation at a local, regional, or national meeting certainly checks that box. We have plenty of faculty who are doing research and writing and doing things like that. So if you have an interest, we have plenty of people who can provide mentorship there. We actually have a PhD level epidemiologist who is our research director, and he's here to help support resident involvement in scholarly work. So it really helps facilitate that. He's got a tight relationship with the IRB, and that helps with research projects. He has established a public health research intern program that is for MPH students. Many of them come from UC Berkeley. But they're here on campus getting some clinical experiences for their own career development because many of them are pre-med students. But they are here to really provide statistical support for our residency program. So they do a lot of the heavy lifting in terms of the research that many of us are not quite as good at, and lets you get kind of more of a macro view of your own research. One thing that I want to talk about here is our culture of innovation. This residency program, I think, really loves to innovate. It's one of the things that energizes me is developing new programs and coming up with new ways of doing things. And my feeling is if we recruit in really energetic, dynamic, interesting people, my job can be facilitator to try, so that when somebody comes to me with an idea for a new program or a new project, my job is to figure out how to facilitate that, whether it's financially, through mentorship, through connections, through whatever it is. We have recently developed a regional ultrasound training program that is for family medicine, internal medicine, and OB across the region. This was the first year where it happened. In July, what we did was 4 days of hands-on ultrasound training with live models taught by physicians who are experts in ultrasound. There were 2 days of OB, 1 day of inpatient topics, and 1 day of musculoskeletal topics. That is going to be paired with ongoing longitudinal simulation training. We're working with SonoSim to work out all of the details there, so that'll be a 3-year curriculum. We also have a faculty member who is fellowship trained in ultrasound, so we have him as a resource. Our inpatient hospitalist program is part of a regional pilot to make sure that everybody is really well trained in hospital ultrasound. So there's a lot going on in that regard. I already mentioned the Community Medicine Global Health Fellowship that we developed. We have a leadership curriculum that runs throughout the 3 years. We think that's pretty unique. It's our view that physicians are kind of naturally viewed as leaders in their places of work and often in their communities. We want to develop some of those skills and interests in our own residents while we have them here. We have a centering pregnancy program. Each resident takes one cohort through pregnancy as part of this group pregnancy program. And just recently, a couple of our residents actually developed a centering pediatrics program with one of the cohorts that was part of centering pregnancy, now has their babies and are part of this centering pediatrics program that hopefully will expand. So a lot of innovation going on. That's kind of just tip of the iceberg in terms of what we're doing, but I wanted to give you a couple of examples. Wellness is something that we take very seriously in this residency program. we're in the fortunate position of being able to design this residency program from the ground up, and in doing so, we wanted to make sure that the training was rigorous so that you'd be really well prepared for your future careers. But we also did it with an eye toward wellness and looking at duty hours and designing it so we wouldn't run into issues there. Doing things like making sure that inpatient rotations seldom back up to one another, so you get kind of breathers in between the more intense rotations. We have a mentorship program so that every resident has a faculty mentor with whom you meet very regularly. You do your evaluations, you do your career planning. They're there for your support and really is a robust program. We have an on-site gym that you're free to use. We also provide gym memberships for every resident. We have an optional literature and medicine course that takes place once a month at a faculty member's home, where you go and read a short piece of literature, have some appetizers or dinner, and get to discuss that piece of kind of humanities and medicine. We have yoga that takes place Thursday evenings after the academic half day and is led by the residents. We have the residents have a regular wine and cheese event. The regional GME office actually has a wellness program and does things intermittently throughout the year. The next one is a Warriors basketball game where they take the residents from across the region to a game and give them dinner and don't invite the faculty. So a lot in the area of wellness. And then finally, I want to talk a little bit about advocating for the future. Part of this feeds into our work with the Vallejo City Unified School District. But one of the big things that we're trying to do here is have a positive impact on the youth in this community and try to improve high school graduation rates, try to increase the number of students who are thinking about careers beyond the end of high school, increase the number of underrepresented students going into careers in healthcare so that our workforce, not just KP's, but the community's workforce looks more like what the population of the state of California does, because right now there's a real disconnect there. So we have this youth development network that one of our faculty, Ruben Gonzalez, developed. Starts down in the middle schools, runs through high schools. It incorporates students at 2 of the local community colleges and then feeds into the undergraduate and medical school level. And the idea is to provide these students some exposure to careers in healthcare, and that means medicine, nursing, laboratory work, ultrasound work, pharmacy work, really healthcare in general. Get them exposed to that because many of them don't have those type of exposures in their home environment. We want to make sure that they get experience with writing personal statements, developing their CVs, professionalism, how to do elevator speeches about themselves, how to interview well, how to dress for interviews, kind of all those professionalism things with the idea of really helping support them as they go through. The program is still in its relative infancy. We think it's probably going to take 5 to 8 years to really see some of the fruits of the labor here, but we're already seeing students going on to 4-year universities from the junior college. We're seeing students get scholarships. These students are very definitely engaged. So we're hopeful that this will really have a positive impact for the longer term. That is what I have for this morning. This is some of our contact information if you want to get in touch with us or follow the residency program on social media. In your folders that you either have or will be given is everybody's contact information. I want you to feel free to reach out to any of us on the faculty or any of our residents. I think it's really important during this interview season. This is a great opportunity for networking as you go to different residency programs. You will find that medicine is a pretty small community, and when you get into family medicine, that's a subset of that and a pretty tightly knit community. So this is a great opportunity to start developing some of those professional networks. If you find people who have similar interests to yourselves, get in touch with them, maintain those relationships. You may find opportunities for research or community medicine or whatever your passions are. But this interview season, you're going to get exposed to a lot of people. So I encourage you to really reach out and start developing some of those professional networks.